Meet Dalia.
And Usman.
After an earthquake struck, Dalia and her siblings have not been able to find their parents. Dalia has to take care of her family, but food is limited, and getting wood to keep warm is scary.
Usman's mother screamed at him to run as their village was being burned by an armed group. When he returned, he discovered his parents had been killed and his siblings were gone. An older boy approached him and told him they would protect him.
Dalia and Usman represent the millions of adolescents and young people living in emergency settings across the world.
Why should we care? There's 1.2 billion reasons to care. During emergencies, adolescents face disrupted or destroyed family and social structures, separation from support networks,
and a new environment full of dangerous and unfamiliar conditions, making it more difficult for adolescents to protect themselves.
When a disaster strikes, adolescents' sexual and reproductive health needs do not disappear. They increase dramatically.
Dalia continually faces the risk of sexual abuse, exploitation, and violence. She may feel forced to approach the men in her village to get more food and water for her family, at whatever cost that may be.
Usman feels alone and scared. This older boy offers protection, even if that means becoming a child soldier. Doing so may require him to do things he is not comfortable with, and the armed group may ask him to show his loyalty by killing another person or using rape as a weapon of war.
In humanitarian settings, adolescent girls and boys face increased risk of sexual abuse, exploitation, and violence, including rape, transmission of sexually transmitted infections. Adolescent girls have unique risks. Adolescent pregnancy and childbirth are extremely dangerous because their bodies are not ready to have children. These unwanted pregnancies also increase the chances of unsafe abortions and maternal mortality. These risks are exacerbated during emergencies as barriers to accessing services increase.
Adolescent boys also face unique risks. Not all adolescents are the same. Aside from gender, there's age, sexual orientation, disability, marginalization, and other factors. Their needs, barriers, and risks also differ and often go unmet, due to their age and assumptions about what they need or want, and their abilities to make their own decisions.
However, adolescents are creative, passionate, and resilient. They are capable of developing creative solutions to difficult situations, and have the assets to do so.
From the onset, we must meaningfully engage adolescents both during the emergency and through to recovery. Building support from their community, particularly its leaders, is critical to increasing access to and use of sexual and reproductive health information and services.
We must strengthen links between services that adolescents need and use. All these strategies require looking beyond health facility services.
We must think about how the approaches work together
to adopt a holistic lens and collaborate alongside adolescents and young people
to save and improve lives.